You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauren Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life.
Stem cell research can revolutionize medicine more than anything since antibiotics. Ron Reagan. How's it going, Travis?
I'm sore. I changed my weighted workouts to all 30 reps per set, and it is literally kicking my butt. But
Nice.
It is time to train for more endurance since it's mountain season.
Woo woo.
Also known as, camping season, hiking season, and soon hunting season.
With your bow?
Yeah.
Woohoo!
I'm so excited.
That's awesome.
How's it going, Lauren?
It's going good. We have some growth in our garden. We have
Already?
I know, we have a teeny tiny
seems
poblano
quick.
pepper grow. Well, I mean, they were transplants. They're not from seeds.
Okay.
Because I think we were too late to start with seeds this year.
Gotcha.
We should have planted them earlier. So we did some transplants. But we have a tiny poblano pepper growing and some strawberries too, and I'm so excited. Also, after our last episode on writing and journaling, I was re-inspired to make a goal for this summer to continue writing my story that I started over spring break several months ago because I haven't touched it since. Since I have some extra time this summer, I feel like this will be a nice way to get those creative juices flowing again.
Nice.
Yeah.
Good.
So I'll probably update you guys on that in future episodes. We'll see how it goes. What are we going to talk about today?
A very brief overview of stem cells and their treatments and potential.
Nice. Sounds good. Yes. There's a lot of information. So we are going to summarize, but first, let's start with the different types of stem cells because I did not know that there were 5 different types of stem cells. There are 5. So let's review. There are totipotent or omnipotent stem cells. These are the best known example of these are from a fertilized egg. These are the most powerful in theory. Second would be pluripotent stem cells. These are embryonic and they are the next most powerful. And then there's multipotent stem cells, which are mesenchymal. These are fairly diverse and probably the most used in research. I think a lot of the research we talk about today uses mesenchymal stem cells. These can differentiate into bone, muscle, fat, and cartilage cells. Then there's oligopotent stem cells. These are hematopoietic. They can differentiate into blood cells. And then finally, there are unipotent stem cells. These can only create one particular type of cell. So for example, muscle stem cells, which can only then be muscle stem cells. Muscle cells.
And they turn into muscle cells. Yeah, so the idea, I guess we should go over, is the idea behind stem cells and why people are excited is because a stem cell is like a blank sheet and can turn into anything. So it's got the DNA of whatever. This would be why the fertilized egg cell is the most promising in theory, is because that one cell type from the fertilized egg turns into a human.
Right.
So it can turn into anything that a human needs, any organ, any tissue, any muscle, that kind of deal.
Yeah. So we have some research on stem cells and prostate cancer. One study looked at the efficacy of using placental-derived stem cell exomes on treating prostate cancer, and they found that these exomes are effective at selectively inhibiting the growth of aggressive prostate cancer cells.
So there's a lot of research on knee osteoarthritis. So first thing we're going to look at is adipose-derived mesenchymal stem cells and knee osteoarthritis. Current conservative management strategies for knee osteoarthritis are aimed at symptom control. Pharmaceutical treatments are limited and they have serious side effects, often, which we talked about on a different episode. Surgical total joint replacement remains the accepted treatment for knee osteoarthritis that is uncontrolled by conservative therapies, but it is not without complication. Up to 20% of patients experiencing persistent pain and loss of function at 12 months after surgery. And I just want to make a comment, being a physical therapist that works with mostly patients that are older. Most of the time, conservative medical treatments are not even tried. There's a BS thing that you have to do for Medicare. Basically, there's a specific physician or surgeon here. Most of them will send people in for like 2 treatments, and one will send them in for 1 treatment and then say that they failed conservative treatment. So
what the heck?
It's not real. It's BS, and
That's
it's
just
a way
setting you up for failure.
Well, you're not even trying.
Right. But I mean, like, to prove their point that it failed, so let's go to surgery.
Correct. And their proof is that that physical therapy did not fix this person's knee that has been in pain for 2, 3, 4, 5 years, a lot of times, in one day. Session. Yeah. So it's a joke. So when they say conservative management doesn't work, understand that it's not tried. They try shots very often, but we rarely see somebody that's actually trying to avoid surgery. It's like, hey, we want your outcomes to be better after surgery, so they send them to physical therapy, or we just want to meet this conservative failure model that Medicare has put in place. So that's just a side note. Anyway, so a study compared a single injection of stem cells versus double injection of stem cells versus control with conservative treatment, which again was not exercise, so it's really a waste of time. But both treatment groups receiving adipose-derived mesenchymal stem cells showed clinically significant pain and functional improvement at completion of follow-up at 12 months. The adipose-derived mesenchymal stem cells were associated with successful disease modification, with comparison of treatment protocols indicating that 2 intra-articular injections by stem cells separated by 6 months achieved more consistent OA stabilization than a single injection. Placental mesenchymal stem cells and knee OA, because I'm tired of saying osteoarthritis. There's a pilot study on placental stem cells for knee OA. Remember, placental would be one of the more powerful because the placenta, they have more ability to change into different types of cells, more ability to specialize. That's the word.
That's the word.
Early after treatment, there was significant knee range of motion improvement and pain reduction for the group that received placental mesenchymal stem cells. That's cool. Significant improvements were seen in their quality of life, activity of daily living, sport and recreational activity, and decreased OA symptoms in the stem cell injected group until 8 weeks. That's awesome. Those are all great. These awesome. Clinical improvements were also noted in 24 weeks post-treatment, but were not statistically significant. In other words, conservative treatment did just as well in their longer term measurement. So, chalk one up for potential exercise, and we should probably use it. Bone marrow derived mesenchymal stem cells in knee osteoarthritis. Studies have demonstrated successful, safe, and encouraging results for articular cartilage repair and regeneration. Most studies demonstrate a decrease in poor cartilage index, improvements in pain, function, and quality of life, with moderate to high level evidence regarding safety for therapeutic administration. So they're safe. A moderate number of cells were identified as most likely to achieve optimal responses in individuals with grade greater than or equal to 2 knee OA. The importance of these studies is that knee replacements are not without side effects or perfect in any way. They're extremely expensive, running around $30,000 for the surgery alone, and then several thousand more in PT and other follow-ups. Usually PT after a total knee arthroscopy, arthroplasty. I said the wrong word. A total knee replacement, usually PT will last about 3 months after that.
Yeah. So, more research on stem cells and rotator cuff injuries. So, in a systematic review and meta-analysis of 22 studies, they they found results that demonstrated that the ultimate strain in the stem cell group was significantly higher than that in the control group at 4 and 8 weeks. Muscle weight in the stem cell group was higher than the control group at 8 weeks, while no significant differences were detected at 16 weeks. The stem cell group had lower visual analog scores at 1, 3, and 6 months, and higher American shoulder and elbow surgeon scores at 3 months. Walking distance, time, and speed in the stem cell group were significantly superior to those in the control group. Again, rotator cuff repairs are common, costly, and extremely painful. Usually you aren't allowed to use your arm for anything for several weeks after surgery, and rehab takes half a year or more.
And just so people listening know, the visual analog scale, that's like the 1 to 10
Pain
scale of pain. Mm-hmm. Yeah. Stem cells and traumatic brain injury. Traumatic brain injury is an important cause of human mortality and morbidity, which can induce serious neurological damage. Currently, clinical treatments for neurological dysfunction after TBI include hyperbaric oxygen, brain stimulation, and behavioral therapy, but the therapeutic effect is not satisfactory. Again, they just completely forget about physical therapy. I don't understand why they don't talk about this, because we treat TBI. I literally treat TBIs every day.
I treat it a lot as well in kids.
Yeah, right. Recent studies have found that exogenous stem cells can migrate to the damaged brain tissue, then participate in the repair of damaged brain tissue by further differentiation to replace damaged cells, while releasing anti-inflammatory factors and growth factors, thereby significantly improving neurological function. That is really cool. Mm-hmm. This is still in early phases of testing and mostly studied on rats and animal models at this time. Some types of stem cells have been tested in human studies and are showing exciting results. However, the studies in humans have been small sample sizes and have yet to include control groups. So we need a lot of more research in this area, but holy cow, is that exciting if you can fix the brain.
So exciting. That's so promising. We have some research for stem cells and multiple sclerosis. Few drugs have been approved for the treatment of progressive multiple sclerosis, and those that have are limited in their efficacy to active forms of the disease and fail to halt degeneration or promote repair and regeneration. Central nervous system stem cell transplantation has demonstrated encouraging therapeutic potential in preclinical studies of neurological diseases such as progressive multiple sclerosis, and there is a growing understanding of the mechanisms of action through which they act on the injured CNS. So again, some super exciting, promising early results.
Also, some exciting stuff going on with stem cells and Alzheimer's. Again, in animal models that is successful to reverse Alzheimer's. Recent preclinical studies on stem cell therapy for Alzheimer's have proved to be promising. Cell replacement therapies such as human embryonic stem cells or induced pluripotent stem cell derived neural cells have the potential to treat patients with Alzheimer's, and human clinical trials are ongoing in this regard. That was a lot of big words.
Oh, a lot of big words. You did a good job. This one is exciting for me in the field that I work in. So they've started doing some research on stem cells in autism and cerebral palsy. Numerous animal studies have demonstrated functional and survival benefits of cell therapy in models of brain injury. Most have been conducted in small animal models of acute injuries such as stroke, hypoxia, and intraventricular hemorrhage, but a few larger animal models exist. At least 20 clinical trials of cell therapy in children with cerebral palsy or brain injuries at risk for developing CP, such as hypoxic ischemic encephalopathy, have been reported, and more are ongoing. 9 randomized studies have been published, and there is substantial variability in all aspects of these studies. A systematic review and meta-analysis of 5 of the studies detailing study-specific characteristics was recently published, concluding that there is significant gross motor improvement of limited magnitude after treatment with cell therapy. And then for autism, as of May 2020, there were 15 studies of cell therapies in autism spectrum disorder, and 2 randomized controlled trials have been published. Some of these studies have shown improvements in ASD symptoms with use of certain types of stem cells or combinations of stem cells.
Stem cell research is currently undergoing for diabetic foot ulcers. Recently, stem cell therapy has emerged as a new interventional strategy to treat diabetic foot ulcers and appears to be safe and effective in both preclinical and clinical trials. However, the variability in the stem cell type and origin, route, and protocol for administration and associated use of angioplasty confound easy interpretation and generalization of the results. Again, we need more research, and they need to do a better job of making the research kind of sync with other research so you can figure out what works and what doesn't.
Right, exactly. I think for all of these things, we need more research. But
yeah.
Stem cells and stroke. Stem cell-based therapies for stroke offer promise because of their potential to provide neurorestorative benefits. Stem cell-based therapies aim to promote neurogenesis and replacement of lost neurons or protect surviving neurons in order to improve neurological recovery. Neural stem cells have been shown in preclinical and clinical trials to promote functional recovery when used in intracerebral transplantations. They've also started using some bone marrow stem cells and mesenchymal stem cells, which have been shown to enhance neurogenesis in preclinical models in intracerebral transplantations, but lack clinical evidence to support this therapeutic approach in patients and appear to be less effective than neural stem cells.
So in conclusion, it seems that we should have more studies on this since it's been out longer than Lauren and I have been alive. But hopefully we'll get more research soon, because the research that we are getting is promising on multiple systems, really. Yeah. There's also research in multiple cancers. There's research all over the place. We couldn't bring it all in. It would have taken days and been a very boring episode. But we wanted to give some introduction to stem cells and what's out there.
Mm-hmm.
And
super exciting.
So if you have something like a rotator cuff repair coming up or a knee replacement, maybe you should consider finding out more about stem cells and potentially saving yourself from a very, very painful, long rehab process after surgery.
Yeah. And or at least exploring and advocating for yourself for physical therapy while we're still waiting for stem cell research.
Yeah, that too. Because a lot of them, we're having a lot of research that shows that you can avoid surgery with conservative management and physical therapy for a lot of different conditions.
Yes.
And it's worth a try.
Yeah, for sure. For sure.
Great job today, Lauren. Thank you for everybody for listening, and we'll see you next time.
Great job, Travis. See you guys. Bye.
Bye. Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.